I feel like so often in these conversations when I'm looking at like the future of Medicaid, I feel like I'm like this harbinger of doom. But I will say like one concern that I have is that a lot of the research and advocacy around both Medicaid coverage for doula care and addressing maternal mortality, what is really foregrounded in particular is the racial disparities in maternal mortality and morbidity, right? So like the fact that like Black and Indigenous pregnant and birthing people are up to 3 to 4 times more likely to die from pregnancy and pregnancy-related deaths than their white counterparts. And so in so many of the legislative history or the legislative statement of purpose that for the legislation that was passed for Medicaid coverage for doula care, and in a lot of, I would say, even like the research that has come down around the benefits of Medicaid coverage for doula care, this addressing racial disparities of care has been really foregrounded. And so, you know, one of my kind of concerns, like sort of like waiting for the other shoe to drop, is like we've already seen that this federal administration is quite hostile even to the idea that racism exists. And so we've already seen also a lot of funding cuts for research and funding for research involving what this administration calls DEI, right? Diversity, equity, inclusion. I do have some concern to the extent that the research is looking specifically at racial disparities of care or really drawing from findings around racial disparities of care around maternal mortality and morbidity and pregnancy coverage. I do really worry and am concerned that to the extent that that funding is cut or is reduced, or to the extent that those researchers feel like they are silenced or not able to do that research, that really is going to have direct impacts on our ability to advocate for that care. Because at every step in the way, that research, academic research papers, you know, published reports, all of that research and findings have been really integral to our advocacy, right? Like legislators have asked for it. Health plans have asked for it.